Hey there, welcome to today's episode of Navigating Nursing School with your nursing tutor. Today, I am going to tell you if you think you need to memorize all medications for your nursing pharmacology class, if you think you need to pay a lot of money to buy drug cards or spend hours and hours and endless hours making 100 different drug cards just to do well and learn what you need to, think again. I am going to tell you a better way today. I'm going to explain this better way. And not only that, but I am going to show you how studying pharmacology this way is not only going to reduce your study time, but it's also going to make medications a lot less overwhelming for you to understand in nursing school so you can remember what you need to know and be able to answer questions about it on your exams. If you don't know me already, let me introduce myself. My name is Nicole. I am a professional nursing tutor with over 15 years of experience, and I am the owner of yournursingtutor.com, where I help nursing students and pre-nursing students just like you get through nursing school confidently and calmly. And I actually have a free gift for you today that is going to go along very nicely with this, the topic of today, and that is a free 10-minute overview video with download on my Silver Bullet study system, which is the best way to study in nursing school. And you can get that by going to www.yournursingtutor.com/SBSS. That's Silver Bullet Study System. The abbreviation is SBSS. Okay, and you're going to need that for today because it does play a role, but the Silver Bullet Study System is not the only thing you need to be successful in your nursing pharmacology class. I actually advise nursing students when they come to me for help with pharmacology you take the Silver Bullet Study System and you overlay it with something called the prototype method. And I am shocked at the number of nursing students and even nursing instructors who have never heard of the prototype method. I was just talking to a nursing instructor the other day that I met with, and she had seen one of my TikTok videos where I talked about it, and she's like, I had never heard about it. Now, luckily, she was not a nursing pharmacology instructor. She taught, a different nursing class, thankfully. But even so, there are meds in that class too, right? So I love that I was able to educate her on that because now she can help her nursing students to even tackle medications in her non-pharmacology nursing class a little bit easier. So what is the prototype method? The prototype method goes like this. So first of all, I'm sure you've noticed if you've started pharmacology that all of the medications are broken down into drug classes, right? They're broken down into drug classes. And the reason we do this is because all of the medications inside a single drug class are pretty much similar. They're very, very similar. That's why we can group them together. It's like a family of medications, right? They have very similar mechanisms of action, very similar therapeutic effects, right? Especially the therapeutic effects. Now, the prototype method says that what we need to do is choose one medication from that drug class. And if we study and understand that prototype medication, we can apply everything we know about that one prototype medication to every other drug in that drug class, and you're going to be okay on your test. Okay? So bear with me. I'm going to explain in a little more detail how we do this and give you an example. So let's say that you were studying non-steroidal anti-inflammatory drugs, right? NSAIDs. You'd say, okay, well, what's the prototype? Ibuprofen. Okay, might be the one that you'd pick. If you were going to do opioid narcotics, what would be the prototype? Morphine. How do we pick the prototype? There's a couple different ways that I suggest. One, the most easiest being you choose the prototype the same way you choose a class president in elementary school. It's just a popularity contest, okay? Whichever medication is most commonly used, most popular, most well-recognized, it's usually the prototype. Now, you can verify, like if you're not confident choosing it just based on that, you can verify this by going to your textbook because chances are your textbook might be teaching you using the prototype method. Even if your instructor didn't tell you about the prototype method, a lot of pharmacology textbooks do use the prototype method when they explain the medications in each chapter. Another thing you can do is simply just go to Google, okay? I love Google as a study resource, and so you can just go to Google and say, what is the prototype for this drug class? And Google will tell you. Now, this is choosing the drug class is the first thing you do whenever you start the silver bullet study system. Okay. And then the second step, if you're doing a pharmacology silver bullet study system outline, is you would choose your prototype for that drug class. Now, I also like to just jot down at the top of the page a couple of other medications that are in the drug class but aren't the prototype, just to get their names in your mind, right? Like, yes, you don't have to study them in detail, but you've at least seen their names before. This is also a great time to look and see if there's any, if they have any common endings or anything else that will help give you a clue to know if like a strange med or a med name that you're not familiar with is in that drug class. So if a lot of drug classes, not all drug classes, but a lot of drug classes do have similar endings. And so if you see a medication with that ending, you know with a lot of confidence that it's in a particular drug class. Now, why does the prototype method work so well? It works so well because, like we said, it's a popularity contest. The prototype method, the prototype of the drug class represents all the other medications in the drug class. There is a reason, like I said, there's a reason that they're all grouped together in a drug class. It's because they're all pretty much similar. They're all similar. They all kind of do the same thing. That's why we can group them together. And then when you get to your test, when you get asked questions about a medication on your test, really all you have to do is identify what drug class is this medication in. Even if it's not the prototype, and chances are, honestly, you're going to get tested on the prototypes way more often than you're going to be tested on any other kind of medication. So that's just another good reason to study the prototypes. But you will sometimes get asked about medications that are not the prototype. That's okay. As long as you can identify what the drug class is, and that could be, through the endings because you do recognize the name, or maybe even just context clues. Like if it's a patient that's described that has high blood pressure, you can take a wild guess that the medication they're on is probably an antihypertensive of some sort, right? And then that's part of using your critical thinking skills. And then you answer the question as if that medication were the prototype for the drug class. And 9 times out of 10, that's all you need to be able to answer the question correctly, even though you never studied that specific medication, because you do know generally about that medication because of the drug class. Now, I occasionally have students who get a little nervous, or I have trolls especially on my TikTok account, whenever I talk about the prototype method, be like, oh, I fear for the future of nurses. I don't want to be treated by a nurse who studies with the prototype method. Well, that's pretty short-sighted of you, because literally nobody can memorize all of the medications out there, much less in nursing school, in order to be a safe, effective beginning nurse. In nursing school, you're intended to be a generalist. Okay. You're getting your foundation, you're getting your feet wet, you're learning how to learn and learning how to think like a nurse. So there is no need to go into detail on all of the minor differences between medications within a drug class when you're in nursing school. Now, later on, if you decide to specialize in an area, let's say you decide to become a cardiac nurse or something like that, then you will start, once you get into that area of nursing, that is when you start to specialize and learn the nuances of different medications within the same drug class. And you're going to learn based on necessity. You're going to learn based on what kind of meds tend to be prescribed in your area or on your floor. And then you can use the same method, the silver bullet study system, to study those meds, even when you are a nurse. And you will understand them way better than if you just tried to memorize all the details. So really, this is just going to save you a ton of study time, because now you only have to study the prototype for each medication class. And yet you're going to get the benefits of as if you had studied a lot more medications. And not only that, but of course, since you're using the silver bullet study system with this method, with the prototype method, you're also going to actually be understanding the medications, which means you're developing your clinical judgment, you're getting flexible thinking, you're improving your critical thinking skills. And so that means that you are studying in alignment with how you're going to be tested on these medications, which always helps increase your grades. So another thing that I like to explain, especially when I'm working with my tutoring students, either one-on-one or in my group tutoring membership, is how we adapt the silver bullet study system when we are studying pharmacology. Because the silver bullet study system can and should be used for literally any topic in nursing school, but depending which class or what topic you're applying it on, sometimes the way we approach each of the 4 steps might kind of change a little bit, just like a little different angle. And that's the case with pharmacology. So if you don't already know, I'm not going to go through all 4 steps of the Silver Bullet Study System in today's episode. So if you have not heard me talk about the Silver Bullet Study System before, make sure you go get the free 10-minute overview video where I literally teach through all 4 steps of the Silver Bullet Study System and explain what that is. And I also have a download that you can print out to remind you of it. And all you have to do to get that is put your email address in on the website, www.yournursingtutor.com/SBSS. That's yournursingtutor.com/SBSS. And you can get that video for free delivered to your email. So anyway, the 2 biggest differences with using the Silver Bullet Study System when studying a medication come in step 2 and step 3. So when we go to step 2, usually that's our step called the Humpty Dumpty factor, because Humpty Dumpty sat on the wall, Humpty Dumpty had a great fall, and now he's broken. But when we come to the medication, if we ask ourselves what has broken or changed, which is our typical step 2 question, it's very tempting to mention the disease process or the reason why we're giving the medication. Like if we're giving an antihypertensive, we might say, oh, they have high blood pressure. That's step 2, what's broken or changed. That is not what we're looking for. The other temptation in step 2 is to mention what it is the medication does. You know, like an hypertensive lowers blood pressure. So step 2, you know, you might make a mistake with the Silver Bullet Study System and say, oh, this medication lowers blood pressure. Nope, that's not what it does. What we're looking for in step 2 when you study a prototype medication is what is its mechanism of action? Like down on kind of the molecular level of the body, what is it that this medication is changing? Okay, what is this? What is it that this medication is changing? So again, with antihypertensives, it kind of depends on which antihypertensive you're working with. But let's say, you know, this one, the mechanism of action is it relaxes smooth muscle, which causes vasodilation. Okay, so it relaxes the smooth muscle, leading to vasodilation. That's it. That can be it. Now, as always with step 2B, we can start. That's where we can like jot down some ideas where we say, why might we want to give this medication? And of course, in this situation, in step 2B is where you'd say, if somebody has hypertension, aka high blood pressure, we might want to give this. Then we go on to step 3. So step 3, normally we say based on what's normal in step 1, based on what has broken or changed in step 2, what's going to happen next. Okay, so step 3 is very similar with medications, but when we say what's going to happen next, we're talking about the therapeutic effect, but not only the therapeutic effect. We're talking about really, I break it down into 3 categories in step 3 when we're doing meds. 1, what is the therapeutic effects? So, you know, the positive things that we want to happen when we give this medication. 2, what are the annoying but acceptable side effects? Annoying but acceptable side effects. And 3, what are the possible complications or adverse effects? So these are the more serious things. So and the reason why I think it's important to separate the second 2 categories out is because if you have annoying but acceptable side effects, some of them can sound kind of bad. Like a good test writer can write those annoying side effects to make it sound like it might be serious when it's not. It's just annoying. And so usually these are not things that we would quit the medication for. But if you're not studying with the Silver Bullet Study System, you could easily be tricked into thinking, oh, we need to discontinue this medication. But it's really just an annoying little side effect. There might be some home care stuff we could do about it. But when we get to the serious complications or adverse effects, these are the things that are a lot more concerning. They could cause permanent damage. They could be life-threatening. These are the things we might consider stopping the medication for if there's or at least monitoring long-term to make sure they do not happen or to catch it early if the complications do happen. Okay. And then, of course, therapeutic effect should be, you know, the basic idea is like, what is it this medication is supposed to be doing, because we expect it to do that. So that's usually the easiest one to identify. But same as any other silver bullet study system, when you get to step 3, you need to make predictions first out of your own brain. And again, if you know what you need to know about normal from step 1, and if you know how the medication is changing things from normal, then you should be able to make at least some very basic general predictions about how the normal operations of the body are going to change as a result of the change the medication is making. You know, just like if the blood vessels vasodilate and they get larger, that means there's more space for the blood, which means blood pressure is going to decrease. Blood pressure is going to decrease. And what could happen as a result of blood pressure decreasing? Well, you could have a little bit of, it could get so far that you get hypotension, right? That could fall either in the annoying side effect or the potential complication, depending on how hypotensive you get, right? It's like a sliding scale at that point. But maybe if it's just like a little bit of orthostatic hypotension, you know, you get up too fast out of bed and you feel a little lightheaded, almost black out. That's probably one of those annoying but acceptable side effects that can happen with an antihypertensive. And you can predict these things just because you know about what's normal and what changes. But now, of course, you would also go back to your textbook after making your predictions. And the predictions are so, so important, y'all. I can't even tell you. Studying this way won't work for you if you don't try your best to make those predictions in step 3 and 4, and it won't work for you because you're not actually doing the silver bullet study system. Like if you're just copying symptoms out of your textbook or your PowerPoint slide and putting it in step 3, you're not doing the silver bullet study system. You're just trying to memorize stuff. That's not the silver bullet study system. So that's why it's so, so important to understand the concepts behind how to study with the silver bullet study system. This is why, like, I do have a self-study course. You know, I have the free 10-minute overview of silver bullet study system to introduce people to it. I have a self-study course you can buy, but the best way to learn the silver bullet study system is in my group tutoring membership. Like, honestly, in my group tutoring membership is even better than doing my one-on-one tutoring to learn the silver bullet study system, because in my group tutoring membership, you can like write silver bullet study systems, like do your notes, and then you can submit them to me on the forum and I will look at them and give you feedback. And like I've had just this last week, we had a group tutoring session, and one of the members came. She's like, she's relatively new. Like I'd say within the last 4 to 6 weeks she joined. So she's new to the system, already in the middle of her semester. And she said she was trying to use the silver bullet study system for her last exam, did not do as well as she had hoped, and was kind of unsure about what to do next, how she should do it next. And so we talked about a few things. I assessed a few things. I did like a tutoring assessment during our live group tutoring and got some ideas that I think she, that I felt like she might benefit from. But then I also, at the end, I was like, listen, take some of the stuff we talked about in today's group tutoring session, and I want you to do a silver bullet study system on a topic from your next test, and then submit it in our forum and I'll look at it. Like even if you only do the first step 1 and step 2 for me to look at, and then I can start to give you feedback and tell you, because I can tell so much from how you're thinking and whether you're using the system properly when I see an example of what you're doing. And guess what? Like I'm not judging you. I'm not grading you. If you're going to make mistakes, I want you to make mistakes with me. Make them with me. I'm a safe place. Okay. I want you to make the mistakes when you're still practicing with me, so that when you get to your test, when you get to NCLEX, when you get to your real nursing, your first nursing job after you graduate, you're not making those mistakes anymore. You can already think like a nurse by then. Okay. So she did. Like the very next day after our group tutoring membership, she did a silver bullet study system, step 1 and 2 on GERD. Actually, it was gastroesophageal reflux disease. And when I looked at it, she had a lot of really good things going on that I was able to give her feedback on. And I could identify almost right away where one of her disconnects were, where she was misunderstanding a little bit how to do the silver bullet study system. And so the feedback I gave her was actually able to help her save time. Because she was basically overthinking it, which is probably one of the more common nursing student problems that I help with in my group tutoring membership. And so I was able to show her how she was actually studying too much in some areas and how she could have kind of tightened things up to connect the dots better. And so from that feedback, now she's in the process of, she's going to be doing steps 3 and 4, and then she'll submit that. And then I'll look at her steps 3 and 4, and I'll be able to give her more feedback and see, how she is. So it's a very iterative process. It's a lot easier to learn when you've got a professional guiding you through it. So if that sounds good to you, I'd love to help you out in nursing school too. But at the very least, don't forget to get my free 10-minute video on the Silver Bullet Study System. It's at yournursingtutor.com/SBSS. But again, if you want the help from a professional nursing tutor to learn it faster, just jump straight into my group tutoring membership. And you can go there, get information about that at yournursingtutor.com/membership. So I hope the prototype method is helpful to you. It can save you so much time at nursing school. And before you go today, I just have one more quick request. If you got some value out of today's podcast episode, I would greatly appreciate it if you could stop by Apple Podcast and find my Navigating Nursing School with Your Nursing Tutor podcast and leave a 5-star review. Getting the reviews really helps for other nursing students to find the podcast so we can spread the word and help make nursing school a lot better of a experience for more nursing students. And basically, we're trying to change the nursing school culture, right? So that, because if we can change the nursing school culture, we can change the nursing culture to be more positive and supportive to one another so that we don't have to deal with burnout as a profession. Okay? So go to Apple Podcast, find the Navigating Nursing School with Your Nursing Tutor, leave a 5-star review. And if you have a few words, if you have any episode requests, if you want to tell me what you like about the podcast, I'd greatly appreciate it if you leave a written review as well. So until next time, good luck on your nursing school journey.